The majority of Americans are unsatisfied with the healthcare system, and the problems only get worse when you put a magnifying glass up to certain communities. The incarcerated population, for example, has numerous barriers to care unique to the system they live within. In fact, studies show that each year spent in prison takes 2 years off of the inmate's life expectancy.
As time goes by, they're aging, but there's an accelerated aging process that happens for people who are in prison because of the adverse conditions that they're living in. Inadequate access to exercise, nutritious food, poor air quality, and then poor health care. And so people have this accelerated aging where they're experiencing the onset of conditions at earlier ages than they would had they not been incarcerated.
That's Dr. Emily Lupez, a physician and assistant professor of medicine at Boston University School of Medicine. The shortened life expectancy may come as a surprise, especially because of a Supreme Court ruling back in 1976. It states that not receiving adequate health care in prison is a violation of the Eighth Amendment's protection against cruel and unusual punishment.
So this actually makes people who are incarcerated the only population in the U.S. to have a constitutional right to health care.
But this right doesn't automatically guarantee high-quality care, or even good access to care. Lupez says a main downfall of prison health care is the speed of which a person's request is filled.
In general, people submit a sick slip, and then that gets processed. Sometimes it can take days, sometimes it happens immediately. And then what will happen next is somebody will be seen by, could be a clinician, it could be a nurse, it varies facility to facility. But because of this, if somebody has a real problem that needs to be seen by a clinician, it could take days to see a clinician. And during that time, the condition could worsen.
And that's just scratching the surface. To get a better sense of why the health of inmates is so much worse than the general population, Lupez led an investigation. It was recently published in the journal JAMA International Medicine. And though it aims to provide a snapshot of the current problems, a big hurdle that Lupez's team encountered was outdated statistics. Though they used the most recent available national data, that research is from 2016.
The 2016 data was not released to the public until late in 2022. So, even though a new iteration of this data was initiated last year, there's really no telling when it'll be accessible to the public, which is one of the big problems in understanding and addressing health issues for people who are incarcerated, because it's hard to know what exactly the problems are right in this moment when we don't have data on that. And data is just not collected very frequently. And even the data that is collected is often very sparse and doesn't capture the full picture. There's not a lot of data sets on health of people who are incarcerated in general. And then there's even fewer that allow you to look at comparisons between private and not private facilities.
But since these are the only numbers Lupez is able to work with, she forged ahead. Unsurprisingly, the results are bleak. The prison healthcare system is inherently different from the rest of America. They don't have access to private insurance, and if they qualify for Medicare or Medicaid, it's often restricted while they're incarcerated. Despite this, people in prison do still have to pay co-pays.
Unfortunately, a lot of facilities do charge co-pays for at least some visits. I also was quite shocked when I learned about this, especially knowing that the minimum wage for prison jobs, at least at the time of our study, was between 4 and 40 cents an hour, which is quite small.
At the time of her study, co-pays ranged from $2 to $8 a visit, depending on the facility. The state of Texas, however, was an outlier. They charged a $100 copay that covered the entire year, whether inmates accessed care just once or on a consistent basis.
So at the time of our study, there were 42 states plus the Federal Department of Corrections that had copays. Since then, 3 states have eliminated them, Virginia, California, and Illinois, and that Texas copay actually went from $100 per year to $13.55 per visit, up to $100 a year. So maybe better, maybe not, hard to say.
Lupez says that copays are in place to control healthcare costs in 2 ways. The first hope is that it will be a revenue source for the facility.
But what we know from several studies is that the amount of revenue that copays generate is either nothing at all or less than 1% of healthcare costs. And there was a study done in Oregon that looked at their copay system. And in order to administer copays appropriately, it was actually going to cost, I believe it's $3 to $5 per visit, cost the Department of Corrections $3 to $5 per visit because of all the administrative burden associated with charging copays.
Which means that they're not an effective revenue source. However, copays do a good job with their second task, which is to deter unnecessary care. In fact, Lupez says they're too good at discouraging inmates. Since people in prison have such low wages, they have to prioritize what's worth spending their money on.
It can go to the commissary where they can get access to additional food, but also things like for women, tampons, which aren't always provided by the Department of Corrections. Another thing that money has to go towards is letters and phone calls to loved ones. So this is really generating competing priorities for somebody to have to make a decision about where to spend their money. Furthermore, many of these people come from impoverished communities, and when people who are incarcerated don't have funds, it often falls on their families who are in impoverished communities to send them money. And so then we're just kind of creating this vicious circle of poverty and making communities that are already impoverished suffer even more financially.
Going into debt also isn't a great option for many people. In several states, leaving the prison while still owing money will block the person from being able to vote or get a driver's license.
It's not just like, okay, maybe you don't have any money in your account while you're in prison because you had to pay these copays. No, that debt follows you outside of prison. It then goes to collections. And then because it's a debt to the carceral system specifically, you can be denied things such as driver's license and voting rights. So I would say it's a pretty drastic impact on people who are incarcerated, both from the health perspective and financial perspective.
According to Lupez, many people in this tough position choose to completely forego medical care altogether. So while the copays aim to repel frivolous appointments, it also stops people with chronic conditions from seeking care.
What we saw in our study was that people with copays were less likely to access care. And the measure of access that we actually did was having any doctor's visit since being incarcerated, which is a pretty low bar if you think about it for people that are incarcerated for many years and have chronic conditions. Out in the community, we would like to see those people, multiple times a year. So for people to be incarcerated for multiple years, have a chronic condition, not even be seen once is a pretty bad thing.
Letting these health issues go untreated leads to worse outcomes and creates more expensive problems down the road that can affect the rest of America.
For example, from an infectious disease perspective, if there are outbreaks in prison, that can translate to more outbreaks in the communities when people are released. So an outbreak in a jail, for example, can easily translate to an outbreak to a community. Similarly, an outbreak in prison can be translated to the community through visitors and the correctional staff that are there working every day and then go into the community. When people come out of prison, the burden is being shifted from the prison system to the community healthcare system to take care of people who are now worse than when they went into prison. And then, our country in general is struggling with strains on the healthcare system. Our healthcare system for people not in prison is also not perfect. And adding more people that are sicker coming out of prison to that system is also a further strain on the system too. So, it doesn't just impact people who are incarcerated, it impacts the surrounding communities and the broader community as well.
But even if these problems were isolated to just prisons, Lupez says we still need to fight for all Americans to receive timely and adequate health care without having to decide between a doctor's visit or extra food.
We live in a country founded on the principle that all people are created equal. But unfortunately, our attitudes, our policies, the way that we treat people don't always reflect that. So from my perspective, people who are incarcerated are still people. They're entitled to their basic human rights as well as their constitutional protections.
You can find more information about Dr. Emily Lupez and all of our guests on our website, radiohealthjournal.org. For more behind the scenes, follow Radio Health Journal on Facebook, Instagram, and X. Our writer-producer is Kristen Farah. Our production manager is Jason Dickey. I'm Greg Johnson.